This is the March 30th, 2020 Emergency Board of Health meeting. I'd like to remind everybody that this meeting is being recorded by video and audio. So with saying that, I'll go turn it over to Roberto.
Okay, so there's a little script that they're asking us to read. So should have been prepared. We had 30 minutes to prepare and I didn't. Sorry about that. Here we go, remote meeting script. Okay. Okay, as a preliminary matter, this is the Board of Health meeting. I am Roberto Santamaria, the staff support for the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. So members, when I call your name, please respond in the affirmative. Steve Visco.
Yes.
Malcolm McNabb.
Yes.
Aileen Weld.
Yes.
James Cooper.
Yes.
Rita Higgins.
Yes.
And then for speakers today, we have William Pittman.
I'm here.
Okay. Don Holdgate. I think you're observing.
Here.
And Lauren Goldberg.
Here.
Gary Shaw.
Here.
And Libby Gibson.
Here.
Here. Okay. So next item. Good afternoon. This is the open meeting of the Board of Health. It is being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. And the order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded, so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless public participation is required by law. This meeting will not feature public comment. For this meeting, the Board of Health is convened by video conference via Zoom, as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care to not screen share your computer. Anything that you broadcast may be captured by the recording. All supporting materials that have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the post agenda unless the chair notes otherwise. We are now turning to the first item on the agenda, but before we do so, permit me to cover some of the ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I, or the chair, will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comment, questions, or motions. Please hold until your name is called. Further, please remember to mute your phone or computer when you are not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage in a conversation with other members, please do so through the chair, taking care to identify yourself. For items with public comment, which we don't have any, after members have spoken, the chair will afford public comment as follows. The staff will activate a chat feature on YouTube, and members of the public who have comments or questions can use this feature to communicate with the public body. Instructions are on the town's website. The chair's staff will do their best to address each question or comment. And each vote taken in this meeting will be conducted by a roll call vote. So, okay. With that said, I need a drink of water now. I am going to ask that we take into review the emergency order that was forwarded earlier. We are looking to do a clear definition of what the emergency orders mean. With that, because it's so new and some may not have had a lot of time to look at it, I'm going to ask Lauren if it's okay for you to give us a brief synopsis of the declaration, and then we can go from there.
Certainly. Thank you. Just give me one sec.
Absolutely.
I will get over to, all right. So the purpose of this supplemental order is essentially to re-emphasize the particular issues that resulted in the board and the select board and the police chief and the Cottage Hospital president, and making the decision to suspend regular activity at construction sites, and also to implement the stay-at-home order, essentially. And one of the reasons that we think this is important is that there's been some significant developments in the COVID-19 response since the time when this order went into effect, but also because the unique situation, the unique position of the town as an island and the limited medical capacity, et cetera, medical care capacity, are all things that were considered and weighed in reaching the decision about issuing the original order, but it doesn't say so as much as it does in this order. So in this supplemental emergency order that we prepared. So we really, I don't know what the legal term is, we pumped up the thinking in the whereases to actually reflect some of the information that has been in the town's letter to the governor that includes all of the issues or many of the issues that the chief and the Nantucket Cottage Hospital and Roberto had all identified as being difficult for Nantucket, as well as some of the kind of general issues that make it difficult for construction and landscaping to be monitored on Nantucket, and not the least of which is that 100 to 300 people might be traveling back and forth every day if their construction ban was lifted, and also that we know that construction and landscaping often go hand in hand. You know, our ability to essentially manage the medical issues as they are, meaning, you know, if we wind up with a steep curve on Nantucket, we want to make sure we're able to attend to the patients that we have. We don't want to add to the number of confirmed cases. And we're also concerned about our ability to also provide support for persons who might not have the COVID-19 virus, but for example, someone who might get injured. So limiting the number of active construction sites, limiting active landscaping, really helps achieve all of the interests, the health interests for the municipality. So that's the beginning. That's all the whereases, and I can go through one by one if you'd like. I'm certainly happy to. But I have a feeling that all of you have heard this directly from Director Gary Shaw, and then also from the chief and Roberto. So, you know, it's really up to you whether I go through each one separately, or if you feel like this summary was kind of sufficient and understanding of where it's coming from. You do have it in front of you, I hope.
I think the summary is fine. I just like a little clarification of the state's point. In other words, it's suggested that there's no construction. Is that what the governor said?
So thank you for that question. I actually, it's incredibly nuanced is the answer. So let me try and answer the way I think the answer is meant to be. I believe that the governor, you know, again, you know, Martha's Vineyard and Nantucket, all 6 towns of Martha's Vineyard and Nantucket requested clarification on this issue because it is that important, especially here, that we have some clarity. And there was a discussion earlier in the week with certain state officials that really didn't wind up kind of aiding us in understanding if there was consistency or inconsistency between the town's orders and the state's order, the governor's March 23rd kind of stay-at-home order and essential business order. So this week we've explored that internally, and our position was that our ability to regulate construction and construction and landscaping services, lawn services is what's in my head, that authority is consistent with the authority that the governor has asserted through this order. And the idea of it being consistent, although the plain language might suggest otherwise, is that order is essentially meant to apply uniformly across the board, so that if, for example, it was determined that construction services could be accomplished consistent with the governor's order and in a safe way, not exposing anyone to additional risk or not overburdening the island for medical, et cetera, that those services would be able to continue. However, it has been explicitly recognized that local boards of health do have the ability to make determinations, particularly based upon the circumstances at issue in their town. And so the point of today's order is essentially to clarify what those local issues are for the record, so that when we look back, we see, okay, well, we know this is why we did these things. We had this understanding from the governor's office that as long as there are particularized decisions being made, that would be acceptable and consistent with his March 23rd order. So that's what we tried to do today in the supplemental order.
Thank you.
One quick announcement, because the YouTube issue, it is streaming live on NCTV 18's website as well. And that's also going to be recorded. Sorry, I just got a few messages that the YouTube is still down.
Thank you. So the whereas is essentially address, as I said, all the things that you've been talking about for weeks. The size and location of the island, the limited access to personal protective equipment, the limited hospital resources, 14 beds, no ICU units, the whole idea of the curve and the spike and how we would react to it, the potential for police, fire, and ambulance services to be overtaxed and overburdened, the lack of mutual aid, and the lack of staff that we have at this time to ensure that job sites be safe, including that, we can't commit emergency first responders to performing construction detail work. And so essentially we cannot confirm that those sites are going to be safe and in compliance with the state's guidelines. So this says if emergency work is required to make a location safe, for example, that they will have to comply with the guidelines that have been set forth by the governor's office, but that those guidelines will be mandatory. In addition, we have language that essentially says all non-essential construction and landscaping will continue to be prohibited and immediately cease if they have not already. Applies to all work sites, including those that were previously permitted. That essential construction could come to the Board of Health and or the building commissioner, but that essential construction is essentially limited to things related to the COVID-19 emergency or to addressing issues that come up on an emergency basis. And I'm summarizing, that residential and commercial structures do not constitute, work on residential and commercial structures do not constitute, construction on unoccupied residential or commercial do not constitute emergency work unless it falls into one of those other categories we just discussed. We also talked about having the site be secured, that any public safety issues be addressed. We indicated that only skeleton crews would be permitted to enter for the remainder of the moratorium and the period of the supplemental emergency order, and even then only to ensure safety and security. another area where we said that if in fact there is a place where emergency construction, essential construction continues, that there has to be a COVID-19 liaison officer to be identified by the contractor, who must maintain a daily compliance log. And then the last part is essentially individual workers who are the sole worker or employee on a job site other than at an occupied property, and work done by an individual on their own property will not be prohibited from proceeding, provided that the job site or property isn't subject to other additional state and federal workplace laws and regulations like OSHA, and further that the work can be performed without delivery of materials because the order doesn't allow for that, for delivery of materials.
So a single worker can, you said, in their own residence, or?
They could work at their own residence
But could a single worker work somewhere else
if it's unoccupied.
if it's unoccupied?
Yes.
Okay.
Okay, and as long as the job isn't subject to OSHA type reporting requirements.
Right.
So it has to be small scale. Again, I think, especially for this board, the idea is to be focused on public health, of course. And so the idea is that if a person is in an unoccupied location by themselves, they're not likely to be transmitting COVID-19 to anyone else. It still requires, though, that all of the social distancing, et cetera, continue to apply.
Dawn?
John, you're still
Sorry,
on.
just trying to unmute. Just question, what if two people, like we had a question earlier about a father and son who occupy the same household, and they're doing small maintenance type jobs on unoccupied dwellings. Can they get an exemption for that type of thing?
Well, that's a good question. So basically what it says is single workers who are the sole employees or workers on a job site other than, other than an occupied property, and work done by the individuals on their own property. So the only way that they could do that is if they could meet those requirements, and they certainly could talk to the town about whether they meet the requirements or not. So because it's one worker, my take on that, and Roberta, I'm happy to have you weigh in at any moment, but my take on that would be that they could each individually do work at an unoccupied property on their own, but they couldn't do it together.
Sorry, I was muted. Correct. Yes, one person. Unoccupied properties as well. That's it.
So that would mean, whether they're family or not, the two in question.
Yeah, whether they're family or not. So basically what it also means is it's limited to simple maintenance tasks, simple small tasks. You're not going to be redoing a roof with only one person. Because as soon as you start opening it up to more than one person, then we're going to get flooded with a bunch of variance requests and all this stuff. And that's just something we don't need right now. So a single individual person. We also if we get flooded with so many, we won't be able to enforce it. And it might as well not have a ban at all.
Helene, this is Helene Weld. Does this not create an undue burden on enforcement?
Maybe the chief.
Yeah, I think we can make it work with just the one person involved. If we start adding, brothers, sisters, cousins, and stuff to the list, then I think it gets too burdensome. We wouldn't be able to sort it out.
Jimmy?
Is the town employees reducing the number of people they have? Are they going down? Are the crews being lessened? The people at DPW are they just working with enough people to make things happen, or are they still at full employment?
I can answer that. Most town departments, well, all town departments, are either doing no work at all, they're only doing essential work. Different departments like police, DPW, fire have reduced down to absolute minimum levels. The idea is that we can keep some workers home and hopefully healthy in the event that the workers we currently have working become ill. We have kind of a replacement workforce. So everybody is down to absolute minimum numbers to perform essential services only.
Thank you.
I'm curious what the hospital's perspective on this is.
Mute. You want to minimize physical contact as much as possible in this environment, and I think that by what I've heard you talk about, that would allow that to occur. This disease doesn't care who is related to who. It cares about what it can get a hold of and then proceed into another infectious case. Did you want me to give more than that, or are we just responding to this particular question?
No, it's more just I just wanted to see what your thought was about having just one person on the site rather than, because I think we're all in agreement that having more than one person on a site is probably not going to happen.
I fully support that.
Okay.
Rita?
Yeah, I do just think that I think it's a massive slippery slope, because I think there are construction workers that are not related but live together. And so then that becomes, I think that's the justification for father-son. But if it's then, what about my roommate? We both live together and work together. So I do think it is just a massive slippery slope that would preclude any enforcement, really.
Okay. Yeah, it sounds like the YouTube channel is finally up and running. So, in my opinion, we can hold the line on one person. We do realize how hard this is. We don't take these decisions lightly. We understand that this is people's livelihoods, and that really it's a big burden. So this is a way to at least allow some of the work to still continue in as safe of a way as possible.
Lauren?
Thank you. I also wanted to add that the order is, it says it's in effect essentially until it's rescinded. I know the Board of Selectmen, the Select Board is going to be revisiting on a week-to-week basis. I forget, starting April 1st, April 3rd, I think April 3rd. And so, I think that information will be developing to help and analyze whether it's appropriate for this order to continue as well. And that we also are continuing to get guidance every day from both the state and the federal government. And I think that Mr. Shaw has been really terrific about explaining the risks, in particular for Nantucket, if this construction ban is lifted, because in addition to the risk of additional people, maybe transmitting to one another, it's also the risk of that the hospital wouldn't be able to handle other types of needed emergency responses, such as to injuries. So, I think what you're proposing is that an individual can continue to do minor work on a minor job site or at their own home by themselves, and that in an unoccupied location, and that will ensure that people aren't transmitting from one person to another, at least to the best of our knowledge right now. And that's based on all of these conclusions, and all the whereases are all based on the information that you've already been digesting. So the only new thing here is that we included the rationale and justification for the decisions that have been made. so that people can look at it and kind of see in one place, okay, this is why, this is why we're doing what we're doing here.
Steve,
Yep.
have we had any pushback from anybody in the construction business, or does everybody seem to be going along with the order?
Roberta?
We've definitely had some pushback. Everyone's trying to justify themselves being an essential worker, and we get it. You know, it's work, and we are interrupting people's income streams. So we have had a few requests for waivers. We've only granted a minimal amount, 6 to be exact. So it's really tough. So we are getting some pushback, but in general, from what we see outside and what we see on the roads, or lack of what we see on the roads, in general, people are complying.
What are some of the pushbacks that you have approved?
So Chief, would you?
Yeah, most of the waivers have involved where somebody either had a roof opened up on a house that had a finished interior and they needed to get it, you know, they could assure us they could finish it within a day to prevent any damage. Or we had a couple of foundation issues where one in particular where a gentleman had a large amount of dirt that he had taken out of his foundation. It was piled up next to the open hole. And the big problem was the weather was coming in on it. If he wasn't able to put walls up, it was just going to go back into the hole. So we allowed him to move the pile further away from the hole. I think there was another one, 2 of them that were involved hazardous material or dirt that had been soaked with oil from leaking oil tanks that was piled up, one at a residential property and another one out at the DPW. We allowed the hazardous waste haulers to come in, load that dirt, and haul it off island during the waiver or during the construction ban.
Thank you.
Read it.
I just wanted to ask, and I don't know how much the other Board of Health members have been hearing, but there's the pushback is that I've been hearing is the whose order supersedes whose in terms of the state over the select board. And my understanding is that by the Board of Health adopting this, it ends that question, and essentially this is the order that supersedes anything the state has or clarifies the state. Or let's put details. Is that correct?
Lauren?
How did I know that question was going to come to me? So this order will supersede any provision. It's actually what I would suggest is a supplement to the earlier order that makes it clear that there are local issues that are being addressed here that cannot be addressed kind of across the board in the state's order. And where the Board of Health has authority under state law to regulate infectious disease, it seems in infectious disease situations, circumstances, it seems to me that having the board do this as a supplement is underscoring that this is in fact the local law for the time being, and that if and when the Board of Health and the Select Board decide that it's appropriate to lift it, then you know, if there was something less significant imposed by the state, then they would go back to the less significant order. Also, let me just point out that even in the governor's order right now, just taking aside the town's action, the governor's order says that the only way that even essential businesses can keep operating is if they're able to demonstrate that they can do so safely in accordance with the guidelines. And it's my understanding that the way that this has been interpreted is that if a Board of Health decides that those guidelines cannot be met, which is essentially what you're doing here with respect to construction and landscaping, that then the local Board of Health has that authority under state law. So essentially the governor's is kind of a intended to provide uniformity, to provide access for companies and workers that in particular areas of business, but that doesn't take away from the board's ability to say, well, here, that's actually going to be exceptionally dangerous. And I think you've heard Mayor Walsh in Boston, for example, say he doesn't have the staff to enforce. And so he doesn't have the inspectors, he doesn't have the police staff. And so it's that same kind of rationale that we're relying on, but instead of it being Boston's rationale, it's Nantucket's rationale.
Rita?
I have a question about then who should be determining the dates. Right now, the select board has said until April 6th, but should it be coming from the Board of Health, or does it matter?
Mr. Chair, is that okay if I respond?
Yeah, go ahead.
Okay, thank you. So I think that really, and I think it's been a collaborative process to get to here, actually. And I don't think any of this would have happened without both, aspects as well as the public safety aspect all being considered. I think the select board has already said that it intends to relook at things at April 6th, and certainly the select board's action would be informed by the Board of Health and and Roberto's position on these things. So in some ways they're involved, and even at the bottom of the order, we have included that the Board of Selectmen, the Select Board, the Chief, the Town Manager, and other staff are also, have taken actions that's action consistent with this order. So short answer, or the direct answer, I guess I should say, is that I really think the two are intertwined, and they'll be informed by each other's position and the information that we get between now and then. Certainly the select board is trying to look at this from the broadest angle, and so is taking into account things that are not necessarily right in front of the Board of Health.
Okay, so there's no sort of process is required. Which board says the date first?
Not under state law, no.
Okay.
Bill?
Yeah, Steve, I think everything Lauren told us about how this order, the legal ability about it, I think one thing that's important to understand is how this group or this list come about to begin with. And this has kind of been pretty misunderstood. But the Department of Homeland Security issued directives to the states that provided a list of essential services. And what happened was the Commonwealth adopted that list as the list of essential services with little or no modification to it. What was never mentioned was the cover letter to the federal government's guidelines says this specifically. Decisions informed by this list should also take into consideration additional public health considerations based on the specific COVID-19 related concerns of particular jurisdictions. That sentence was missing from the governor's order, or it was written in such a way that only Lauren could really understand it. She sorted it out for us, and I think we're on good standing, and we're definitely consistent with what the federal government's guidelines are regarding these types of things.
Any other questions?
I have one question, Stephen. Public bus service on the island, that's still going to run the way it has been?
Roberto?
Yeah, it's still running. They've basically boxed off the driver, and they've made the 6-foot separations within the bus, so it's a very limited ridership. But it is still running because some people do depend on the NRTA to get to work, and the essential workers to get to work and back and forth.
Okay, thank you.
All right.
Anybody else have any more comments, questions? No? Do we want to get a motion to accept the amendment to the emergency order as written.
Mr. Chairman,
Yeah,
if I may, could it be to approve the supplemental emergency order as written?
yes.
Thank you, sir.
Could we get a motion to approve the supplemental order as written?
So moved.
Can I get a second?
I'll second.
Okay, seconded by Jimmy, and I think we'll do a roll call for approval. Malcolm,
Yes.
Jim,
Yes.
Helene,
Yes.
Rita,
Yes.
and chairman says yes, so amendment is approved. Supplemental order.
Excellent.
Thank you.
All right, thank you very much. That makes our work a lot easier.
And then we'll, keep everybody posted up to the select board's next meeting and how everything's going up until that date.
Of course.
Okay.
And I think the last thing on the agenda is Board of Health members' updates and concerns. We have this on here. If there's anything that is specifically coming up that you want us to look at a later meeting, or you want us to look at as the emergency management team as well.
Does anybody have any concerns, comments?
I would like to make a comment overall, if I could. I'll start by first thanking all of you for your leadership, your focus on community safety, your support of the Public Health Department and the Cottage Hospital. This is an interesting time. It's unprecedented in at least my lifetime. I've said that in print, and I say that to you. And we've made significant gains in how we're keeping this suppressed, I believe, on the island currently. The rapid action, the focus on sheltering at home, the community stepping up and listening to a call for action, understanding the significance of this disease, seeing how this disease has decimated countries, the elderly, and now we're seeing it's impacting those that appear to even have no comorbidities that would make them more susceptible. So it is a significant threat. What we have done here, I believe, has contributed to why we aren't currently seeing a surge in cases, but we are right now at the precipice of what we would be seeing and might be seeing if social distancing and physical distancing was not put in place and understood by the community. This is a time where the incubation of the cases that are on the island, the disease floating, started just a few weeks ago. And so as we move forward, the effect of this order and the effect of the community's efforts are going to be showing dramatically as we look at, can we keep this caseload to a few pebbles that are, an analogy would be bouncing along the bottom of the river, and don't have to turn into a big boulder, creating a dam and then, of course, water over the dam. We will see that in the next 10 to 14 days. And this is known. It's a fact in epidemiology and public health that right now is not the time to let off the gas. It's actually time to double down and look at this very significantly, how you distance yourself at home, physical distancing, how you wash your hands, how you minimize contact in the public is going to define exactly what occurs on this island in the next 10 to 14 days. We've been doing significant preparations at the hospital. I can say that I've never worked with a more focused and dedicated team of professionals that you've gathered here, your family, your friends, people from off island that come and live and work here. They are ready. I've never seen a facility more ready for what we don't want to have happen. So I thank you for your actions, and I open any questions. I'm open for any questions and any assistance we can provide. But thank you. I say stay the course.
Thank you, Gary, for everything you and the staff has done. And I've been out there and seen it. I think we're all doing what we need to do to keep the island safe.
Absolutely. Thank you very much.
Anybody else have any questions for Gary or anything?
Just a thank you. You've stepped into this position at perfect timing, I think. So thank you. And I had to go to the hospital for something not related to that, and I was really impressed with how the staff was dealing with it. So big thank you.
I'll pass that on and thank you. This is your hospital, and we want to make sure that we do the best we can now and in the future.
Everybody all set?
All set.
Motion to adjourn.
Motion to close this meeting.
I'd make a motion to adjourn.
I'll second.
Okay, seconded by Jimmy. All in favor?
Aye.
Okay, great. Meeting's closed. Thank you, everybody.
Thank you.
Yeah, thank you.
Take care.
Take care.
Thank
Safe.
you.